next is the muscular system. So when you're younger and in the early stages of your life, your muscle mass and strength will maintain a steady increase. During your adult life, the muscle mass and strength will stay at their peak before declining in the older part of your life. Sarcopenia is a disease that is associated with aging. The loss of muscle mass and strength will then affect balance, as well as the ability to perform tasks. It was previously thought that this disease was only seen in people with sedentary lifestyle. However, it was later found that this wasn't the only factor, and that people with active lifestyles were also getting this disease. Atrophy begins to take place. So this is when the tissues or organs begin to waste away due to the degeneration of cells. This then results in the heart becoming less efficient. The heart muscles will become weaker, therefore the heart will be able to pump large amounts of blood around the body, so this will result in fatigue more quickly and recovery times increasing due to the heart having to work harder. So this will affect endurance events such as marathons, as well as the heart becoming less efficient. Muscles will also become less efficient due to this process. Most units will also decrease, so this will result in a slower reaction time. This will therefore affect sports that require a quick reaction time, such as sprints due to the starting gun, or table tennis as it's played at speed. When you age, the average sit and reach scores for the ages will decrease directly proportional with age. So the average score for children aged 5 to 12 is 10 inches higher than that of a 40-year plus adult. On average, the greatest flexibility occurs between the ages of 7 and 15. When you age, the cross linkage between the collagen fibers increase, which then in turn decreases flexibility. Loss in water as well increases calcium salts being deposited, which will increase muscle stiffness as it affects the connective tissue. As well, muscle sheaths become thicker, which leads to muscles and tendons becoming stiffer. When you're older, you also lose heat more easily, which therefore will reduce the pliability of the muscles. All of this make sports that require high levels of flexibility very challenging. Therefore, gymnastics would be much harder for an older person compared to a younger person. So, strategies to help decrease the effects of this on the muscular system are performing regular exercise so that the muscles strengthen, as well as the heart muscles, as well increasing the amount of protein that's consumed, as this will also aid muscle strengthening. Next is the respiratory system. So the muscles involved in the respiratory system, will become weaker, which makes inhalation and expiration more difficult, as well as your defensive mechanisms will begin to waste away. So catching illness will become much more regular. With weaker muscles, less air is inhaled and exhaled, so therefore there's less oxygen available for the muscles to use for exercise, so this will therefore affect aerobic events. The lung volume will decrease due to extra collagen being formed in lung tissue. This will then decrease the elasticity in the lungs, therefore decreasing lung volume. This will have a negative effect on gaseous exchange, as less oxygen is able to fill in the lungs. When you age, the bones around the chest and spine become thinner as well as change shape. So this change in shape can cause the rib cage's efficiency to decrease as it cannot expand as well. Also, the diaphragm becomes weakened, which could potentially prevent enough air entering as well as exiting the lungs. The tissues that surround the airways may also become less effective, which could cause the airways to close more easily. As well, the alveoli can lose their shape, which will result in air getting trapped inside the lungs. With this taking place, it means that not enough oxygen is entering the lungs and the body. This will therefore decrease the rate of gaseous exchange and aerobic capacity. So obviously all of this makes it harder for aerobic sports as they require high levels of oxygen. But to help reduce the effects, exercise can be done, as this will strengthen the respiratory system and the muscles. As well, you can have diaphragmatic breathing can also be done, which improves the strength of the muscles used for that type of breathing. So it forces the diaphragm to contract when you breathe, and therefore that will strengthen the muscle.